Hey, Dr. David.
Hi, Frenchie.
How are you?
To be honest with you, I've had better days. I actually threw my back out, and it's embarrassing. I was bending down to get a magazine on Saturday afternoon,
I
and
hope it was a sexy magazine. At
if
least.
it was just kind of more of an informative type magazine. And I feel like the Leaning Tower of Pisa for the last 48 hours.
And are you, Dr. David, are you an easy patient or a difficult patient?
That's a great question. Doctors make the worst patients. So
So
I
I
never see the doctor. I try to. I would say 95% of the time I self-diagnose and self-treat myself, which is terrible. I don't want to admit this. Um, and yes, I'm not the best patient. You're right, and I'm a bit of a wimp. So
Mm,
yes.
yeah,
So
I appreciate that humanity about you, though.
yeah.
Yeah, I
So
like that. So I'm gonna tell you, come on and let's get some of that Epsom salt in there.
yeah. So I did Epsom salt. I did a little stretching. I'm sorry about that. And that's it. That's all I've done. I haven't taken any muscle relaxers or anything like that. I'm trying to do it all natural.
Okay, let's stay on that homeopathic path. But speaking of natural, that's that's a good segue.
Yeah, let's
Uh,
do it.
I I wanted to touch on this topic in love time science because I I feel like women have been generationally cursed with a lot of myths and mistruths around the vagina.
Ain't that
And
the truth?
for the vagina havers out there, I feel you. I see you, and I wanted to have a conversation so we can correct some things. And for those who have additional questions, you can email us at lovetimescience@gmail.com. That's love triple X
It's got
science
to be triple
at
X.
it's gotta be triple X
Yeah.
at gmail.com. And
And we're not
but
talking about Q. Yeah.
yes, but you know, the vagina does all of this work and doesn't get the admiration she deserves, right? From size to looks to smells and scents, to textures to tightness. This poor vagina has been ripped to shreds in our culture. And for the vagina havers, I need the vagina havers to go out and be really proud and be really comfortable in their own skin. And I'm not seeing a lot. I still hear people talk about the vagina in terms of being dirty and how it needs to be cleaned. Even though the vagina is a self-cleaning oven, but we still to this day have this disruption of information about uh, the maintenance of taking care of the vagina.
Well, I mean, look, Frenchie, I think just look at ourselves in the sense that in the 20th century, we were propagating douching and it was being marketed as sort of a marital hygiene thing that you needed to do in order to keep your vagina smelling good and tasting better. And so without proper douching or hygiene products placed in your vagina, you were not as desirable, right? That was being marketed to us. And I remember there was quite a few brands. And if you look through history, I mean, during the Victorian era, for example, anytime you discuss vagina, it was almost like impurity, hysteria, right? It was dangerous. Like you could get a disease
Yeah,
by touching the vagina. And so I
yeah.
think, unfortunately, a lot of these have been passed down still. And unfortunately, a lot of these myths or sayings or thoughts are still believed by so many people. And I'll give you an example. How many patients come to see me for, let's say, vaginal tightening surgery? And I give them a mirror so we can look together because I want them to see what I'm seeing when I'm looking at it. And how many times does a patient say, "Oh, I don't want to, I never look at my vagina. That's gross." Why is that
And
great?
she's so pretty. Why are you
Yeah.
ignoring her?
So this, I think this show is about debunking these myths, and I can't wait to get into it. There's some science behind it, and I wanted to get into that a little bit, but just thought I would bring that up as far as history.
Well, I want us to stay on that path because, there's a lot of myth fueled shame, secrecy. And you're right, like the marketing towards women and their vaginal well being is very aggressive. I
Yeah.
mean, like even soap. I mean, it's soap. It's the skin. It's the body. And like companies have charged more for soap for women than they do men. Like I use Nivea for men. I use men's wash, and so people are like, well, why do you have men's wash? I was like, because it's wash, like
Yeah.
it's
I mean,
soap, and I don't want to pay more for my soap just because I have breasts and a vulva. Like, what?
yeah. No,
Show me
you're
some
listen.
appreciation.
That's right. So marketing is a big disappointment a lot of times, but it is important to really understand what goes into those soaps, right? Because I need you guys to pay attention at the ingredient list because there are certain factors that increase the risk of infections, that increase the risk of dryness, that may change the pH balance and the good microbiome that happens in your vagina. And I think part of today's show is to let's just get into the science of it. I think it's important. First of all, if you don't mind, Frenchie, I'm just going to talk for a quick moment.
Hit
It's
it.
important to understand. It's important to understand what when they're referring to moist cleansiness of the vulva versus vagina. Really important to understand the vulva. You guys, again, I don't want me to keep repeating it, but it's really the external anatomy, right? And that relates to the labia majoras, the labia minoras, the clitoral hood, the mons area. It does not correspond to the inside of the vaginal canal because completely different environment and it needs to be addressed differently. And I think
Hmm.
so many products on the market are labeled as vaginal cleansers when they're
When it's
really
really
vulva.
vulva, right?
And I think people then interpret that, use it in the wrong context, and then they wonder why they have an infection or they wonder why their odor has changed. And so I want to make sure that people are really understand that part. And they need to also understand that the normal pH balance of your vagina is acidic. The pH is between 3.8 and 4.5. And things that are going to alter that pH are going to cause a disruption in the good bacteria that live in your vagina. So the dominant good bacteria species is Lactobacillus, right? And during our reproductive years, estrogen supports that. But as our bodies change, as hormones change, and we start to lose some of that estrogen that's really connecting with those estrogen receptors in your vagina, we're decreasing that natural pH acidity, and therefore we're unable to support the concentration of good lactobacillus in your vagina, and we become more prone to infections. So when I said we need to change the vaginal routines over the years of our life, that's what I mean. We have to really pay attention to these things. And so, these lactobacillus obviously produce lactic acid, but if you prevent the normal acidic pH balance, you're going to cause an overgrowth of unwanted bacteria in your vagina, and you become more prone to yeast infections, to other infections that may disrupt the normal scent of our vagina. And so I want to keep that in mind. And the other
So,
thing to
Dr.
remember is,
Ghozland,
yeah,
real quick, I because I think this is a good time to kind of bring this up because when young girls are introduced to their menses, this is not a conversation that is had. And so we're teaching habits to our daughters as if they're going to stay our daughters, as if not that there's a trajectory that they're going to have an evolution with their bodies and with their partners at some point in time.
mhm,
And so when you say that it's changing over time, how does a mother or a father, dads, introduce this conversation to their child that is beginning their menses?
Well, first of all, I think the big confusion, especially for anybody really, it doesn't have to be younger child or teenagers, is the fact that there's a misunderstanding of what vaginal odor means, right?
Mm.
So first of all, a vaginal scent most of the time comes actually from the sweat glands in your vulva. It usually also comes from a disruption in your pH balance. So just because there might be a small scent to the vagina, which typically is actually normal, right? To have no odor in your vagina is actually abnormal. So you want to, it's not natural. We all have a certain scent that we give off, and same with our vaginas. So I think demystifying the fact that the vagina is self-cleaning and that you don't need to be proactive in changing the way you smell or the way you interpret your vagina is supposed to be is going to go a long ways, because I think you'll do more harm than good. And then also, I think it's really important to make sure that people understand that different stages in our lives carry different needs. So for example, in our younger years, reproductive years, when you go through pregnancy, that's a time where your vaginal pH dramatically changes because your hormone balance changes. And as you get older and your hormones change, we talked about perimenopause, menopause, those are also stages in your life where hormones change and affect our pH balance. So we need to keep those in mind. And then when we are using products, we need to keep in mind what is in those products. Are there essential oils? Are they fragrance heavy? Are they alcohol based? All of these things, for example, actually are doing us more harm than good. And so I think it's really important to understand that. And it's also important to understand that you want to let that vagina breathe, right? Wearing super tight underwear that's not breathable all day is not a great thing to do. I see you have a question. Yes, Tom.
Dr. Ghozland, let's talk about the thongs. Because we have to talk about the thongs.
Go ahead.
Keep them, throw them out, use them sparingly.
I'm sorry, repeat that.
Keep them, throw them out, or use them sparingly.
I say use them sparingly.
I don't think a lot of people realize that the thong shifts.
Yes.
That you are moving, sometimes you are moving fecal matter up to the vulva or up to the vagina. And and for those who, this is because now, no one wants to see a line in their garments. So we are a thong happy society.
You brought up a really good point. So that's an excellent point, and I think nobody talks about that. We all heard, you need to wipe a certain way, right? Everybody knows that, but nobody really knows, or not too many people are aware that you're correct. By using certain underwears or thongs, you actually can propel the bacteria like E. coli out of your perianal area into the vaginal and disrupt the microbiome. So things that are going to disrupt the microbiome, obviously fecal contamination, antibiotics are a huge common one. Do you know that stress actually affects the way your microbiome is, because it affects your immunity? And if your immunity is not strong, your pH may change. And that even having sex and ejaculation, because semen is alkaline, right? So sometimes after intercourse, you can have a transient, and I say transient because it's not a big deal. You can have a transient change in pH from ejaculation inside your vagina. So the best thing to do is, usually I do recommend go pee after intercourse. That's a great way to do it, right? And so I think once you start to understand that changes in your pH balance are typically just transient, they're not permanent, and most of the time you don't have to do anything. Your vagina is going to do it for you. It's amazing like that.
So get your water up before you have sex. Yes. And it's also good to kind of hold, because you get that extra pressure. And so that can also contribute to your orgasm as well. So when your bladder is kind of full, it can lead to some extra pleasure sensations.
Well, let me ask you kind of a weird question. Did before you became educated and got your master's and all this stuff, when you were growing up, did you have any false beliefs now you realize that maybe you believed or held true when it came to vaginal smell, health, all that stuff?
A few. One particularly, this notion that when you have uh, a menopausal bleed through your clothes, one, that you can feel this particular discharge, this stream. And so there's always an incident where some woman has ruined the greatest outfit of the day because she started her men's season and did not know. So this notion that that you know, and therefore you should be ashamed of what is occurring, that to me is a really big one. Uh, Tampons, for a lot of parents thinking that if their teenage vulva haver uses a tampon, that is going to encourage her to be sexually active, or that it is some type of penetration. And so that's another huge
Hmm.
misnomer around tampons. And even now today, we're learning more about feminine products such as vaginal pads that are not good for the body. So we don't know if we should go vertical. We don't know if we should go horizontal. I think that these are all still misnomers today.
Yeah, good point. And I think also when it comes to cleaning your vagina and vulva, right? I always say, look, water alone is great. Water mixed with a very gentle soap or cleanser is great. I don't think douching on a regular basis is a good thing to do. And in all honesty, I actually think it may actually increase the risk of certain infections.
Should you even do it at all? Really?
I personally am not a fan of recommending douching.
Yeah. Yeah,
Yeah.
many doctors are not. I don't know why uh they're only still on the shelves, but for that, there's still so much shame around
100%.
in her body.
a hundred
Other than
percent.
that, it's just a shame enforcing product.
Mhm.
And so I want people to move away from that.
So, Frenchie, do you think the audience? I think it's important to talk about what is a moisturizer, right? A vulvar moisturizer versus a lubricant. I think let's get into that because I think
Mm.
vulvar moisturizers can be daily applications, just like you moisturize your skin. You want to moisturize the vulvar area, which again includes your labia majoras, your labia minoras, and that will improve the feel and integrity of the tissue and help with dryness around the area. But that's a bit different than what a lubricant is, right? And
Very,
a
very different. You have your
lubricant,
water-based lubricants. You
yeah,
have
which I love, right?
I do too. Shout out to Uber Lube. That's one of my favorites because it's so clean. And there are a lot of eco-friendly, vaginally eco-friendly lubricants now that we're not, because usually you see lubricants, they're all sticky and gimmicky and sticks to your finger, and it should not.
Yeah, so that reminds me. So I think part of that stickiness is the glycerin that goes into it, right?
Uh,
And I think now today I don't usually recommend any lubricants with glycerin in it. I'm not a big fan of lubricants that warm up or cool down. I think sometimes they can cause some issues. I'm with you. I'm all about as natural as you can be, water based. I prefer fragrance free. I think there's no need for fragrance. Um,
Agreed.
yeah.
Agreed. So that brings me to something else that's important around lubricant and sex. Is pain during sex normal?
Ah, great question.
Mhm.
So, I hear that a lot, and the answer is when you're experiencing pain during sex, it's usually not an emotional thing, although it can be. It's usually your body telling you that something is wrong, something is off, something needs to be addressed. And so if you're experiencing pain during intercourse, you need to have that looked at, discussed with a professional because there's no reason you're having pain during intercourse.
Mm-hmm.
And
Even though, see, and then that's another myth. So that if you lose your virginity, it's going to be painful, and so people are kind of uh, bearing it, waiting, or that somehow you can revirginate yourself after you not have sex for so many years. You cannot. But also, even virginity is just a construct. uh
well,
because
you bring up a good point, Frenchie. I don't mean to interrupt you, but let's talk about virginity because it's something I tend to see occasionally in my practice and talk with. So that is discussing what the hymen is, right? So in a lot of cultures, it's important for a woman as she is about to start her married life to be deemed a virgin. And believe it or not, in certain cultures, you actually you need to be inspected to make sure that you are a virgin. And during that inspection, what are they looking for? They're looking for what they interpret as intact hymenal membranes, which are sort of like a web, like finger-like projections that are connected inside your vagina at the opening. And the reality is this: if you ride bikes frequently, if you do the splits, if you dance, no matter if you ride horses, if you run fast, if you fell down and hurt yourself, you can easily break those hymenal membranes. So
Mhm.
just because you do not have the presence of hymenal membranes doesn't necessarily mean that you've had sex before or penetration before. And so I only bring that up because I don't know if we'll ever have another episode to talk about it, although I think we probably should. But hymenal membranes are often interpreted as a sign of virginity. And I think to me that can become dangerous because I can't tell you how many women come to my practice scared, anxious, because they are about to get married and they claim to never have had sex, but they're very nervous because maybe they're physically active and they enjoy sports, or maybe they fell on their bike handle one time. I mean, or the crowbar. Um, so for whatever reason, oftentimes I get asked these questions: Am I still a virgin? And the answer is it's not a straightforward answer because there is no correct answer.
But there's a resounding no, because there's no such thing as virginity. What we refer to it in our work is a sexual debut. A sexual debut is all inclusive. If you look up the definition of virgin, it centers around penetration, and specifically a man penetrating a woman. So that leaves out everybody. um, and also it is very limiting to how people have sex and engage, and it's not also always through vaginal penetration. So we say sexual debut. So have you had your sexual debut yet is all inclusive and encompassing on how expansive sex is in the first place. And also just minimizing shame and this notion that uh, that specifically girls and women are held to the standard of purity while boys and men are not, is also equally biased, socially biased,
Yeah,
sexually biased. And it's time that we do away with those shenanigans. And so the penis havers and the vulva havers can, come together under the umbrella of sexual debut when they decide to have a sexual debut, and that it is all inclusive.
I love that. And well said, Frenchie. Well said. To just kind of take a step back and get back into vaginal health, uh,
Mm.
you know, uh, and I'm not promoting any of these brands because I'm completely unrelated and have no association whatsoever, except that I've used them. I mean, I've recommended them with good feedback. And so when we talk about some of the vaginal moisturizers that I sometimes will recommend, I like Replens over the counter. Replens is just an estrogen-free moisturizer. It lasts for 2 to 3 days. I also like Good Clean Love.
I
And then
love good clean love. Yes.
Good Clean Love is a good one. It's pH balance. It's pretty gentle, and it's a good moisturizing gel that I think a lot of people enjoy using. Um, Bonafide is another good one. Bonafide actually has a hyaluronic acid vaginal insert, and so we can get into that. Some people will use hyaluronic acid, boric acid, right? These things can help improve and acidify the pH balance, and by nature, by doing that, it helps to get rid of the bad bacteria, and
Mm-hmm.
so it keeps sort of a cleaning um, uh, engine in your vagina. So I think those are all great. Um, if you're going to use boric acid or hyaluronic acid, look, at the end of the day, I don't want you to use it every single day. You should use it on a regular basis if you want to, but maybe you want to make sure that your healthcare provider is okay with it also, because there may be other underlying issues. But just thought I would mention those.
I like to think of it as a garden,
As a
right?
garden, it is a
So
garden.
you,
You're
yeah,
total.
so
Yeah.
you have soil that is intended and designed to help, flourish and grow and beautify. And then you have some elements that are in your soil that you need to get rid of. But it's nothing shameful when we
Yep.
think about garden. And I think that it's helpful to think about the vagina the same way. But I have another question for you that I think that we should highlight. Is menstrual blood dirty or toxic?
Dirty or I've never been asked that. Obviously, I don't think it's
Because
toxic.
because as a vagina haver, we get this crap.
Yeah. So let's talk about it, because I think it's important. Where does it come from? I mean, is it coming from is it coming from a wastebasket in our body? The reason people bleed, or they have intermittent bleeding or clotting or spotting, is because it all depends on the lining of the endometrial lining of the inner uterus, right? And then depending where you are in your cycle, that lining starts to slough off, right? So it's just an accumulation of lining along your endometrial lining. And as it slough off, it creates a period. And so there's nothing toxic about it. There's nothing dirty about it. It is part of who you are, part of what makes you you, and absolutely zero to be ashamed of, worried about, or uncomfortable with.
Because especially for those who have an enjoyment for menstrual sex,
Mm-hmm.
and there's a lot of pushback. And again, if that's what floats your boat, gives you pleasure, I while it may not be for you, I do want people to understand that this is simply blood and tissue, that there is not something toxic or unnatural about it for those who choose to engage. And because we don't have enough conversations around vaginal health, this is where we, again, even women are participating in this normalized culture of shame around the menses, around the vagina and vulva. And I don't want us as vagina havers to continue to carry these myths and mistruths about it.
Yeah. So look, I completely agree with you. I think that, again, menstrual flow is absolutely not toxic, right? It consists, like you said, very well said, it consists of your own blood, tissue. It's just a bodily process. So whether you decide to uh, make this something you enjoy participating in, or being, however you want to participate with it, whether it's through sexual or oral sex, it doesn't really matter. It's not dangerous. Nothing bad is going to happen to you ever.
So that brings me to, when should women and girls see their gynecologist? Because some people believe that only vagina havers that are sexually active should see their doctors or should see their gynecologists.
So let me understand. So are you asking me for a routine well woman visit, or just for?
Is it? I guess I'm asking, is the routine specifically for people who are sexually active,
So
or
you
or
bring up
not.
a question. So I think there's different misinterpretations without getting too deep into this. So usually when you think of seeing your gynecologist, if you don't have an issue, is because you're seeing them for a yearly annual exam, right? And that usually consists of a pap smear. So there are algorithms that we follow that have been already sort of guidelines that have been out there by the American Board of Obstetrics and Gynecology and the American College of Obstetrics and Gynecology that actually have when should a woman start their pap smears? And the answer is not, it doesn't, you don't need to start your pap smear the day you become sexually active, although for STI purposes, you probably should. Um, and how long do you continue to get a pap smear? Is it your entire life? Can you stop at a certain point? And you know what? We should make that another episode because I think a lot of people are confused about that. And there's
Yeah.
some very clear guidance on when do you need to start a pap smear, how often should you have it, and how many years should you have, at what point can you stop one? Or should you not stop one? I mean, there's different schools of thought, and I've gone both ways depending on the clinical history of somebody. But if you don't mind, let's table that for a
Yeah.
much bigger
Yeah.
conversation.
We can
Yeah.
make that a bigger conversation. Absolutely. So can we talk about the different types of, I know we don't have much longer because you have patients to see, but can we talk about, vaginal discharge and when do you know something is wrong and when is it natural?
That's a great question. First of all, vaginal discharge is natural, and there's nothing wrong with having it depending on where you are in your cycle. However, if there is a fishy odor to it, if you've noticed a change in the color sometimes, so greenish, sometimes a yellowish color, uh, if there's burning associated with urination, I think those are all sort of easy hallmarks and red flags to pick up on and say, "Oops, I think I should just get checked out."
Yeah, and I also recommend you should know what your vulva looks like and what your vagina looks like in its happy phases
Yes,
so that you can detect a lot more easily if something is happening in your body, and that's why having the mirror and taking a view is so important because if you never know how it generally looks, how fleshy it is, the coloration of your particular vagina, then if something goes awry, it's harder for you to make some type of discernment as well.
I mean 1,000%, right? Because we know our faces so well. How many times you look in the mirror, you're like, "Oh my God, I can't believe how tired I look. Wow, I got bags today under my eyes," or "Wow, look at these wrinkles on my crow's feet area."
Mhm.
But can you do that? Can you do that for your vagina? You should, and you really should for a couple of reasons. One, the vagina is prone to all sorts of things, including skin cancers, right? And so you really need to learn what has been normal for me and what is new and not normal and should get investigated. And the only way to do that is to really memorize what your vagina, your labias, that whole vulvar vaginal area looks like. And once you do that, first of all, it's not gross, it's your body, right? Body exploration. Um, but once you do that, you now have taken the power to understand what is normal for me and what is not normal for me. And then if it's not normal or you have a doubt, that's when you want to start seeking advice.
Definitely, definitely. Well, the stigma surrounding vaginal health isn't accidental. It is very historical. And when you shame a body, you control the person that's living inside it, right? And so
Yes.
vaginal wellness is not about cleanliness or desirability. It's really about your autonomy and your health and your truth. And that's why I was really excited you know, for us to highlight some of these important talking points today so that people can rest assured and the havers can be happy about where they are.
I think you bring up a good point, and that is, you guys, again, just as Frenchie said, there is zero reason to ever be ashamed of your vagina. There's zero reason to ever feel that there's something wrong with having an odor to your vagina, because most of the time it's completely normal. It's really important to have explored your anatomy, so that you can distinguish what is normal for you and what is not. And I think all of these things are just going to improve your confidence, your empowerment, your connection with your lover. And I think by doing these things, you'll get rid of that window that we sort of, that drape of shame we kind of hide it behind. And you know, how many times do you hear, "Oh my God, don't go down on me because I don't smell right." What does that mean?
Mm,
Well, that, like, if you
yeah.
enjoy oral sex, enjoy it, for God's sakes, and,
Yeah.
go for it. You should never be ashamed or embarrassed or feel uncomfortable. And I know that's easier said than done, but it's through practice and through understanding and education that you get to that point. So I'll
And it's
leave.
through conversations like this
Yes.
that we can get to the point. So if they have more questions, again, I'm going to say you can email us directly at love times science. That's love XXX science at gmail.com. I know you got some more patients to make happy. So we're going to roll for now, but we'll be back. And I'm Frenchie Davis, your sexual abolitionist.
And I'm Dr. David Ghozland, your sexual wellness and cosmetic gynecology expert. I hope today's episode was useful. And as Frenchie said, email us with any questions or unanswered questions that we may not have had a chance to address.
Bye, everyone.
Bye, everyone.